pray. Heavenly Father, I want to thank you again for this day. Thank you, Lord, for the many blessings you give us. Thank you for the opportunity we have to serve on our help ourselves as Lord and help us, Lord, to make decisions. We ask that you grant us the wisdom that we need to make the right decisions and seek the best for our county and the best for the system, and we believe in you. And Lord, we want to ask that you continue to bless our country, help to heal our country. We've been divided for the last few days, few years. Lord, we just ask that you bring us back together. Lord, we ask bless this food and bless your body. Just continue to show coming up in your will.
And before I got here today, I heard thing America.
Lee Greenwood? No.
It's already set in. I'm sorry. Great job.
Great job.
It's America. You know, God bless America. It's a beautiful song. The first agenda item is, before we begin, I'd just like to read something. To protect the health and safety and welfare of Tennesseans in light of the COVID-19 pandemic, the public will not have access to attend in person. An audio or video recording of the meeting will be made available to the public at https://www.lincolncounty10government.gov.com. The first agenda item is the consent agenda. Are there any items on the consent agenda that the board would like to be taken off for further discussion? If not, I entertain a motion to approve the consent agenda as submitted. Motion made and properly second. Any discussion? All those in favor say aye.
Aye.
Opposed say nay. Quality report.
We'll start out with patient satisfaction. We did see, first of all, in the emergency department, we continue to have good scores. We're not having any problems. Part of the reason why are things that we implemented several months ago, which is a discharge checklist, and we're doing follow-up phone calls. So, very proud of what's going on there. The inpatient side, we took a tumble in April for inpatient, and we believe that is attributed to the no visitation with the patients. We're not allowed to have a visitor. And to be honest, we didn't have a very good communication plan. And so early in the month of May, we developed, number one, we started allowing visitors back in, but number two, we developed a communication plan with families. And we started using iPads for the families to be able to communicate with their loved ones. And once we started doing that, the numbers went back up. So you can see that our inpatient satisfaction for the month of May went way up, and we're happy about that. And then you'll see outpatient satisfaction there for June. I think that's just because we opened the doors back up and wasn't as locked down as we were before. Secondly, for patient safety, if you scroll on down, we had no falls with injury in the past for April and May. We did have 2 outpatient falls that did have injury. One was a head injury, and one at the Patrick Wellness Center had an abrasion. And infection control, we've had no hospital-acquired infections and no surgical site infections. We currently are working on a new incentive for Foley catheter removal, and we have begun the nursing education for that. We have gotten the nurse-driven protocol approved by the medical staff, and so shortly we should see a reduction in the use of Foley catheters. We did identify that the majority of the catheters we thought were going in the ER, but that was not true. They are actually being inserted in the ICU, and so part of our education is to teach the nurses how to use weights instead of a Foley catheter for urinary output. And then finally, for COVID testing, we've done a total of 172 here. 166 have been negative. only 3 positive, and those, again, we have not had a positive since April the 2nd. We do have a new screening process at Patrick Wellness, using their phone, and we're using like something similar to a phone app, and that is going well. I'm sure Justin will mention that when he talks in a moment. And we're going to roll that out at Home Health very shortly and anticipate a rollout of that app here at the hospital by July. We will not do that at Donaldson Care Center. We will continue doing the exact same thing at Donaldson Care Center. So regulatory update, the lab, we're still awaiting our CAP survey, and we just feel like that they'll come any day now, and we feel like we're ready for CAP. CMS and Joint Commission data collection is on hold through the end of second quarter of 2020 due to COVID. And we, as I'm sure you're aware, Donaldson Care Center had the visit from the state. The visit was from a follow-up mandatory reporting issue, and it ended up where we had our annual state survey, which was focused on infection control. And as far as the annual state survey, we did very well. They were very happy with our COVID-19 response and had compliments, had a few recommendations, but that particular piece of the survey was very good.
That's good to hear. Any questions?
With respect to privacy, can you comment on that ED head injury? Is that something you talk about, or no?
Executive session, probably.
Oh, okay. Thanks.
Okay. Any other questions? If not, entertain a motion to accept the quality report as briefed and submitted.
So moved.
Motion made, properly second. Any discussion? All those in favor say aye.
Aye.
Opposed, say nay. Senior Leadership Team Report. Nursing is the first one.
Okay, hospital visitation, again, we are allowing 1 visitor right now, with the exception of labor and delivery, which we're allowing 2, and the end of life. And I'll just mention the issues that I just went through with my mother-in-law, that having visitation is extremely important. And Daryl and Russ both have been very insistent that we be very reasonable when it comes to visitation, and so we have tried really hard over the last 6 weeks to make sure that folks that need a visitor are getting one. I told you about the screening process and the update. Very excited about our little electronic application that we're doing, and we will move forward with that here at the hospital in July. COVID-19 numbers, I already told you that. Let's see, we have resumed split sleep studies, which were on hold. Even when we started back with sleep studies in the middle of May, we couldn't do splits, and now we've resumed that. And then current nursing education, I already informed you about that. So.
Okay. Bob? Yes.
Yes. Mr. Chairman, the scorecard that you have in front of you shows all the key indicators for the month and on a year-to-date basis. Basically, as you look at those statistics, let me just kind of give you a little background. Again, mid-March, we know COVID hit, and so for the latter part of March, we basically took about a 40% drop in our outpatient visits. And of course, it affected surgeries, couldn't do elective surgeries, et cetera. Then the month of April maintained a total 40% down. And again, makes sense. So basically for that whole 6-week period, we were down 40%. May, we're starting to come back, and the month ended up basically about a 20% down from the norm before COVID, pre-COVID. So went down 20 because it was only half a month, and it went down total 40 in April. We're still down 20. June's numbers are looking a little more promising, but they're still suppressed. Probably, if I had a ballpark now, I'd say we're probably down 12, 14% still. So, and again, you're all reading about the COVID resurfacing a little bit too, so not sure how that's going to shake out, but we think we're on the way back, and again, taking all necessary steps to maintain the good news that, Carrie just presented, that we haven't had a case here in the hospital since April 2nd. So I think that's, pretty astonishing itself. So, won't go all through the things again, but again, it's kind of a repeat a little bit of last month as it has been through COVID. While the outpatient, and ER activities have been down, the inpatient activity has remained pretty steady. And again, like I mentioned last month, the ER admission rates from the ER significantly higher than what we had counted all year. They were almost 9% in the month of May. So that attributed to a solid inpatient footing. The other thing I guess I'll mention again, just when we switch to the long-term care arena, the maybe atypical scenario this month was the SNF days that dropped. Of course, again, we were just starting to get back mid-month with the elective surgeries, and so that's starting to build back up. And that is definitely back this month. We're starting to see returns to 29 and 30 ADC levels there in the SNF arena. So that was good. Deliveries were solid, steady, 19. And EMS was still hurt a little bit. Again, COVID was kind of keeping that in check. So that's kind of the big picture as far as the activity and the volumes go. If you go down to the bottom and you see the performance, we were fortunate. We did book in this month some federal and state funding that we did receive to assist us with COVID. The hospital did get awarded a $500,000 state grant based on basically merits and strategic initiatives that we had the consulting group that does our state review, basically a test for the fact that they felt like we were on the right track. We need to continue to do such, and so we were awarded that $500,000. In addition to that, the federal government steered $3.7 million for COVID coming our way. So again, the number shown here obviously reflects those numbers that came in. And then the Care Center also had about $500,000 that came in. So having said that, if you back that off, because those are obviously atypical numbers coming in, the operations themselves would have lost or had a deficit of approximately $417,000, which is actually about the level that we've been kind of trending at for the last 3 months through this COVID, in that range from the deficit of $400,000 to $500,000 range. So a couple other quick things I'll just mention. The Patrick Rehab and Wellness, probably the hardest hit. We obviously know about wellness being hit with the gym having to be closed for so long. And then also, though, in the rehab arena, it's still dependent upon the elective surgeries coming back. And some people, just to be quite honest with you, they're still shy about showing up for their PT treatments. But I think, I won't steal Justin's thunder, but I think he'll tell you that that's starting to improve. And the other thing I'll note is the physician clinics. The deficit noted there includes the fact that we just started up an OB practice, and so that was in the month of May. So we're excited to have Dr. Nobles on board. That will only pick up steam here as we move forward. And other than that, that's about all I had, and would be willing to entertain any questions on those. Okay.
Any questions? You covered your second sheet here, too.
I'm fixing to. Oh, no, sorry. Yeah. Just did the numbers first. And then just a couple of processes and initiatives are in place. Again, really more just a quick update. Continuing to move forward with the physician EMR installation. Late July should be the completion of that. Athena, really excited about that. I mentioned that Dr. Noble started in May, and urology has started limited site process in May, 2 half-days a week, and then cardiology will begin July 8th. So it'll be exciting to get those specialties here. I mentioned before, we feel like we're getting closer and closer on Blue Cross rate renegotiations, which will help us immensely. Annual physical inventory is due this Friday. We're all excited about that. Not really, but, one of those things you got to do. And then I've listed down below the individual, grants and funding that we've received for y'all's benefit. I will mention one last thing, last item on there, just so everyone knows that the, small business loan, PPP loan, had some, recent modifications made to it, very, very pertinent and very favorable to us. Basically extended the period that they track, for forgiveness from 8 weeks to 24. That's very favorable for us.
So that's 6 months.
That's almost 6 months, yeah.
Any questions for Bob? None, we'll go to Darrell.
Okay. Over the last month, since I started June 1st, I've been transitioning with Russ. I've been meeting with providers, employees, other key stakeholders in the area, kind of making my rounds, introducing myself, and it's been a lot of good people here in the hospital and the surrounding area. So I think that's going very well. Bob just mentioned Dr. Cox starting July 8th. He'll be here on Wednesdays and Thursdays, half days. So we'll be working with him to increase business and referrals to our various service lines that we have here. Orthopedics, Dr. Beasley was off to a good start for the month of June. I think I jinxed it because after June 19th, it's kind of slowed down a little bit with him. But overall, our surgery volume and our scope volume as of today is at 91. So it's picking up. Our surgeries and our scopes are picking up. So that's a positive, very positive. Hospitalist, you're aware Dr. Williams will be departing August 3rd, and so we're in the process of reviewing the hospitalist. We're working to find another hospitalist. Dr. Ramos is engaged with us, and he has a couple leads, and those leads don't pan out, then we're going to have to do some other searches and things of that nature to get that covered. We are, from what I understand in the past, due to COVID, Blue Cross would have a bus that would come out and do screening. This year, because of COVID, they're not going to be doing screenings. It's like vision screenings, blood pressure screenings, things of that nature. So we're partnering with Blue Cross to, on July 16th, to provide mammography screenings for Blue Cross members. We will then have opportunity for those individuals to come into our facility, see the good work that our mammography techs do. We have 19 ladies that are scheduled as of today. Dr. Nobles will participate by, if the patient does not have a PCP or primary care provider that writes the order for the screening, then he will be writing that order. As of now, I think there are 3 ladies that have not had an order, or Dr. Nobles is writing the order for 3 individuals. Hopefully that may pick up his business, an opportunity to grow his practice.
Is that being advertised for other
It will be advertised on Facebook, and Blue Cross sent out a flyer or a letter to all of their members. Is that correct? Right. Okay. Nursing home, John Lavater's last day was this past weekend. We were able to secure Cassandra Callahan as the interim care center administrator. She is from Nashville, comes highly recommended, has 20-plus years of experience. And so I know last month the board approved Polaris to help us with a nursing home administrator search. And so they're helping with us on that. We've only received 1 candidate for that position through Polaris. There was a couple of others that Polaris sent us, but we had already received those through Indeed and other recruiting type of agencies. So we told Polaris that, we'd already received those applications.
You use the same source they use.
Yeah, exactly. Probably so. And then, also, we're in the process of interviewing, well, let me go back to the administrator position. We did interview administrator candidate last week, and then we have another interview tomorrow with an individual. And then, on the director of nursing position, Ms. Trevathan's last day was the 26th, but, Friday was her last day. And so, we have, somebody that, we are going through the background and drug screening process, and that person should be in place tomorrow to be the interim DON out there at the center. And, she has, years of experience also. So we're trying to build that team. We do have the person that we're interviewing, or the person that's taken the interim position for the DON. She's also asked us to consider her for the full-time position, which we will. And then also this Saturday, we have a candidate coming in that we'll be interviewing from, she lives in Florida right now, is doing an interim assignment in Ohio, but has 2 sons that live in Shelbyville. So she would like to get closer to her son. So we will be interviewing her on Saturday morning. Under other section, we had the state survey. Started June 17th. Carrie alluded to some of that. The survey ended on Sunday the 21st, and I sent you, hopefully you read the updates I sent over the weekend to you, kind of give you an update on that. And we don't have the final results back yet, but probably maybe in executive session we can talk about that some more. I attended the county commission meeting on June 16th to introduce myself. Mayor Newman invited me to that, and so I thought that went well. Just told the county commissioners who I am, what my expectations are, and things of that nature, and got a lot of positive feedback from that after the meeting and everything from several members of the commission. So I appreciated that opportunity to go there. Senior management team, we started this morning working on updating our strategic plan for the Lincoln Health System. The goal is to present that to this board at our August 25th meeting. So we're working on that new strategic plan.
Do you need a separate meeting for that so we could go in depth? Because this is the 25th of regular monthly meeting?
I believe so, yes, sir.
Okay. I don't know if you give it justice just for that meeting because, we're limited for time, so we might need to think in terms of having a separate session.
Okay.
Yeah.
Okay. Well, I can discuss that with
okay.
with you on
Okay.
that.
All right.
And then,
What do y'all think the other board members think?
I'll tell you, it's not going to be an 82-page.
Yeah. We never have 82 pages. It'd be nice to see one 82 pages.
What we're doing is, we're going to do a SWOT analysis, strengths, weaknesses, opportunities, threats to our system,
Okay.
and then some market share, and then just some bullet point initiatives to help us move forward with,
On second thought, the 25th would be a good introduction, and then more in depth we can schedule at a later date.
Okay.
Okay. Yeah.
Okay.
How long is this gonna be? What do you anticipate?
How many questions you ask? It should be a lot. It should be a lot.
I know you said we were pressed for time, but
No, if
if I don't get out to 8, if I get out at 7, if I don't get out to 8, I don't care.
No, I mean, I don't anticipate it being more
Very
than,
long. I think we could stay to 9.
Mm-hmm.
Well, whatever, yeah, whatever.
I don't want to say.
But for us, with CEO, we stayed to 10.
No. I think we can run through it. I mean,
Okay.
during the board meeting. I won't drag it out or anything like that. I'll hit the high spots, and then what I like to do is like quarterly, kind of give an update
Good.
of where we stand
Good.
and where we're going.
Good.
So maybe
Good.
this first meeting on August 25th, we'll
Okay.
get the overall picture,
Okay.
and then we'll kind of update as we move along
Okay.
quarterly.
All right.
That's okay with the board?
That's good.
Okay. but, I've been working with Russ. Russ kind of, started this fall when, before I got here, but our BioMed, service agreement, is expiring, comes to an end or terminates, August, 14th. And so, Russ went out and has, talked to another vendor and everything about, our BioMed program. And, our BioMed program is, where, we have an individual that, checks all of our equipment, does preventive maintenance, repairs, things of that nature on our medical equipment. You know, anywhere from, let's say, blood pressure cuffs up to our CT scanner or MRI. So, we went out, Russ went out and talked to a company. Our company that we currently use is TriMedics. And TriMedics, sent back a proposal to us. And then we also got a proposal from Agility, which is another reputable, biomed company. They're out of Nashville. And, so basically, the long and short of it is that, Agility wanted a 5-year agreement, and basically, and Russ, I may ask you to help me with these numbers, but roughly wanted, let's see, about, was it 673?
So TriMedics had the agreement for 5 years, and they were charging us $653,000 per year, and that included limited coverage on the CT scanner. We were responsible for parts and everything, and they basically provided PM only. So then to add full coverage, because our scanner is it's about, I think, 3 years old now, so to get full coverage on the CT scanner, that added $75,000 to the cost of the service, so $728,000 per year. So they discounted it down when it was said and done, $649,000. And we asked them about a 3-year agreement as opposed to 5, and they were adamant that they only do a 5-year agreement. And then Agility, they're willing to do a 3-year agreement, and their price is
$614.
It's $614, and it was $605, and then it came into $614 because when you look at all of our equipment, the one piece that's really mission critical is our CT scanner, and everything with TriMedics has been 24/7 coverage, but we rarely use that after hours and weekend coverage, and so both of these agreements are Monday through Friday, 8 to 5. If they had to come back and work on something, it would be at an overtime rate. So we did ask for a carve-out for CT. TriMedics was $105 to cover the CT scanner, and then Agility was like $59. And so, but that'll give us 24/7 coverage. So, on the CT.
So the recommendation is, which one, yeah, okay.
The bottom line would be, with the savings, if we went with Agility, it would have a savings of $114,000 a year savings. Okay. And I've dealt with Agility with West Tennessee Healthcare, and had good response. Took care of our equipment. I'll be honest with you, I was only in it briefly. We had just converted to it before I came here, but West Tennessee Healthcare, they have 6 hospitals and decided to go with Agility. The big thing that one of the big items Russ and I were talking about was 5 years is a long time to be locked into an agreement. And so that's why we're kind of recommending that we go with Agility with a 3-year agreement at $614,000 with the CT P&D covered 24/7.
And that's the extra 59?
Yes, sir.
Okay. Any questions on that?
So that 614 and then 59 more? No,
that was
That sounds good.
Yeah, so, with TriMedics, have we not, we basically gave them notice of termination. We had to give it 90 days in advance, otherwise it auto-renewed. Then our annual rate was $7.28. Like Darrell was saying, just with the negotiations, we're able to get it down to $6.14, so an annual savings of $1.14. And so that's a good thing. And they're both, TriMedics has done a great job for us. And when we got TriMedics, we were grateful to get them. But the market changes a lot in 5 years, and who knows what it looks like in 3 years. It may very well be Agility. And so there's a lot to transition from one company to another. But these companies, TriMedics and Agility, they do it all the time. So end of the day, we'll wind up with a good service and saving some money as well.
And the effective date is when? The effective date?
August 14th.
August 14th. And TriMedics is good through the 14th?
Right.
Okay.
So Agility used to be known as UHS, in case you guys want to know that. They're a very big player in biomed world.
Okay. Any other questions for Darrell?
Does that mean 8 to 5, they're on site to just be servicing everything, regardless of what we tell?
Yeah.
Just keep things up
That's
to par.
all the PMs and all
PMs,
that stuff that comes up.
They be housed in the back here like TriMedic was?
Right now, the TriMedic, John is up on the second floor.
Okay.
Has an office up there.
Yeah, his stuff got burned
Yeah,
out there.
I remembered that, because I think we ended up having to pay them something for their equipment getting burned. Yeah.
Through the insurance.
Or did we?
It was covered by insurance,
Okay.
and then we had it passed up.
Okay. Well, that's an
Done
action.
an excellent job.
Did they?
He has, and he comes around to every nursing station every day. What do you have?
Yep.
What do you have? What do you have?
Yep.
And
He-
he's a huge, TriMedics has been a huge improvement over what we had before.
GE, well, and he in particular has been a huge improvement.
Oh,
The guy before was okay.
Well, that's the expectation then,
Mhm.
to go with Agility.
And what our hope is that, Agility's gonna need somebody. And maybe our hope is that they reach out to John.
Okay. Do we have an out clause in these contracts, just like we do with most everything, or 90, wait, okay, we're stuck, okay.
This will be, there's no term without cause
Okay, okay.
for the 3 years.
So it-
5 years with.
Price will vary, though, with equipment changes. So if you add a different piece or you delete a piece, it'll change.
Okay, up or down?
Up and down.
Okay. Well, entertain a motion to approve making Agility the new biomedic contractor effective August the 14th of this year. Yes, sir. Motion properly made. Need a second? Second is made. Any discussion? All those in favor say aye. Opposed, say nay. That's exactly what we gotta do, is look for cost savings. And Bob, we need to capture that. I know you get like, you prorate it because it could be sometime in August, but that's the type of thing that we need to capture. And we need an update on the one we got going on now too.
I've got it.
Okay.
Just haven't shared it.
Okay. That completes the senior administrative report. Entertain a motion to approve the reports as submitted. Motion made, properly second. Any discussion? All those in favor say aye. Opposed, say nay. Chief of Staff, Dr. Klein's not here, but his report is usually covered in the consent agenda.
He told me to give his report.
Okay.
Everything's going really well. We're just discussing some issues with credentialing with a few providers.
Good.
The report.
Well, thank you so much. Appreciate it. Entertain a motion to accept that report as submitted.
So moved.
Motion made. Properly second. All those in favor say aye. Opposed, say nay. Senior administrative report is dealing with the calendar. This is information, and we'll if there's any questions about what's being submitted. If not, we accept that. Financial operation we've already talked about, so we won't go into any details on that. Human resources are informational reports. Does anybody have any questions about those reports as submitted? It covers the hospital as well as Donaldson. Okay. Those two were for information. The third, the E, is Donaldson Care Report from John Lavender. Any questions about that report? If not, I entertain a motion to accept the report as submitted. Motion made, properly second. Any discussion? All those in favor say aye. Patrick, Rehab and Wellness, we're not going to do that on you, Justice. We're going to turn the floor over to you, Justice.
Thank you very much. I took over February 1st. It has been an interesting 5 months, to say the least. I joked around with Janie Parker if we were doing stock markets that I got her for insider trading because she got out at the right time, right before all the COVID stuff hit. But like everyone else was saying, we took as good a hit as anyone did. At the Patrick Center, we're so service-based. All the patients that come in, and especially the wellness people, being happy with services is a choice. And so we have to make sure that we're meeting all their needs. And when the governor made his decree in March, it really hit us hard. Most of the patients that we see there that are more elderly, they would stop coming. With occupational and speech therapy, that sees the majority of our pediatric patients. You've got mothers and fathers that are very nervous, and so they would quit bringing the kids. And then to kind of the middle part of that cutout, when all the elective surgery stopped, that was a big hit as well. So we've done as much as we could, and it was incredibly challenging, but those challenges brought opportunities to improve what we're doing. We revamped all of our disinfectant protocols and, trying to keep everybody safe as much as we can. Instead of just the 6 feet inside our main area, we go 12 feet and beyond. We converted our basketball court into almost like a MASH unit to where it gets people almost 25 feet apart. So they've got barriers up top to protect people from the wellness people seeing down or anything like that. So you completely private when it comes to that. But if somebody has COPD or some issue to where the mask is very difficult to work out in, if not impossible, we can get you 25, 30 feet away from the next person. So that's always been very important. Our screening over there, we adapted on a daily basis because it seemed like everything changed almost on a daily basis. But now we have taken in the new screening that we were talking about earlier, and not quite a phone app, but it works like it. It's a web-based app to where you will put in your name and then you attest that you're not having any of the symptoms. We still check your temperature, but this is something that you can do from your car where you're not standing in line. You're able to get it real quick with your phone. It pretty much auto-populates everything, and if you have an issue, if you don't have an issue and you hit submit, it comes up with a nice little green check. You flash that to the lady at the front or the gentleman at the front desk, and they'll check your temperature. If that's good, you just move right on. We have instituted masking now in all areas, except upstairs. If you're upstairs, you're under they're doing the social distancing, but it's a voluntary thing, and if you're there to work out, you kind of take that self-responsibility to protect yourself and others. Down in the lobby and in the therapy rooms, all business staff, therapy staff, custodial staff, everybody. We had a maintenance guy there today helping us with an installation. He's wearing a mask. Everybody's protecting everybody. We've heard wonderful feedback from people about how everyone's wearing masks, and you can go to whatever area you need to. I think the only discipline that the masking was an issue with was speech therapy. It's really hard to get a kid to pucker their lips if they can't see you puckering your lips. So they made those, but those are in closed off rooms, so that's not an issue at all. Other than that, just trying to be as educational as we can to our patients and to our visitors is the big thing. And speaking of visitors, we restricted it to where now no visitors can go back into the therapy area, which is something that we needed to do for a while. And the restricting the visitors inside the building to a minimum stealing my thunder. Yesterday was our best unit-based day that we've had since mid-March. Last week was our best unit-based week since mid-March. And, I mean, you could see it, everything was on the rise to January, February was looking strong, the beginning of March was strong, and on the 16th of March, that Monday, I mean, it dropped. It was a pretty quick plummet, but we were starting to build it back up, and you can see it, and it's not just one day or so, it's a steady increase. So I think we're back on the track, with all the surgeries coming back, community starting to come back, but like you're saying, you know, we're staying very, vigilant to what we're doing, because, you know, it doesn't take much to get people scared again. And over there at the Patrick, that's the big thing, that perception is reality. And if it looks clean and they feel safe, then, you know, everything's good. If they don't feel safe, they won't come. So, as far as wellness goes, not my department, but I know that they've got, the basketball court, of course, is still shut down because we're using it for therapy. All the upstairs facilities are good to go. They started using the locker rooms, and the pool, hopefully within the next month or so, will be up and going as well. So I think everything is as good as it could be in the current climate.
Any question for Justin?
No, but I got a kudo for him. I've been hearing about this lady named Nan. I cannot tell you, that is like, I've never met her, but evidently she does pelvic fascial releases, and it's great for pregnant ladies, and people are I'm having people come in and say, I want this, and this is who I want, so.
That's one of the things that we were hoping
It's
to do.
amazing. And what seems to happen with the COVID shutdown, the family groups have gotten together, so there's a lot of gossiping. And that's where it's coming from. It's like my sister, my aunt, my sister, I mean, it's just amazing.
One of the things that we're hoping to do, with the community also, as far as therapy goes, for our local doctors here in town, is to help try to build those community, or those relationships better. There for the longest, we were the only game in town, and, you know, you came to the Patrick Center, that's just what you did. So when the COVID, crisis eased up a little bit, that's one of the things I was, telling the administration that I'd love to do, is to almost stop using some of our fax machines. If you're local, you know, we want to build those connections. You know, I want to take out some of my therapists that are great and let you meet them, you know, on a personal level, so where you can, at least put a face to a name.
I just wanted to fix the patient. You don't have to give me cookies.
Well, could that be a marketing campaign? Pictures in the paper where people can see exactly who he's talking about?
We use that on Facebook, and that was one of the things with the monitors that we've got up. We've got a lot of people that are sitting in our waiting rooms, short amount of time to eat, albeit, but trying to get that stuff and get names with faces and let them know some of the stuff we're doing, even on the wellness side. You know, put up, hey, you know, we're starting swimming lessons coming up, or, we've got, classes and all these dates and times, and, you know, just information, just get it out there a little bit better.
Yeah. That might be something we want to think about.
Right, yeah.
Take advantage
We
of.
talked about that,
Yeah.
take advantage of that, absolutely. Can I ask him,
Yes, sir.
Justin, we had a cool story at our daily safety huddle about, an occupational therapist that went above and beyond.
We've got a job hire in the last probably 6 months. Her name is Jordan Pack. We are blessed to have her. She is exceptional at what she does. She's a better person than she is a therapist, and she's a great therapist. But we received a letter 2 weeks ago from, I think it was Lawrenceburg County, I don't want to say lockup, but their correctional facility there. And they had 2 ladies that were there because of substance abuse, and they were looking for a substance abuse rehab. And just hearing the name Patrick Rehab and Wellness, if you didn't know it, you might think that we are a substance abuse facility. So when we had, you know, I talked about them, like, we need to get these letters back, because they were beautifully written letters. I mean, they just pour the heart out to you, so that can send them to other facilities to get help. Jordan took it upon herself be able to reach out to, you know, and that's somebody that probably never sees the patient, but, you know, to help them get back on track, you know, she took that extra time to do it, and it was appreciated.
She took the extra step, because she could have easily said, we don't do
That's
back and
right.
back.
End of story.
Yeah,
You know, like I said, the letter she wrote, it was beautiful.
Yeah.
I let her speak at my funeral anytime.
that's good marketing for the health system, too.
Yeah.
You know, good marketing. Tell her on behalf of the board, thank you. Yeah. Any question for Justin? If not, entertain a motion to accept his report as submitted and brief. Motion made, properly second. Any discussion? All those in favor say aye. Opposed, say nay. The next is EMS report. Are there any comments on the EMS report? If not, entertain a motion to accept it as submitted. Motion made, properly second. Any discussion? All those in favor say aye. Opposed, say nay. The new business proposal, we've already acted on that. That was part of Darrell's presentation. Anything on the others? Any capital purchases we need to go over? We got a couple of personnel matters that we need to discuss, so we're gonna take a 5-minute break and go into executive session. Executive session at 7:05 and enter back to regular session. We're now back in regular session. We got 2 matters to approve. The first is to entertain a motion to approve the staff recommendation on the direction to pursue on a legal matter. Entertain a motion to approve. Motion made.
Explain that.
Yeah. Need a second? Second, okay. Any questions? All those in favor say aye.
And I abstain.
Okay. Opposed, say nay.
No.
Okay. You vote no. Got 1 no and 1 abstention. Okay, the next issue is entertain a motion to approve the staff recommendation on matters involving the LPN.
To accept their recommendation.
Okay, motion made, properly second. Any discussion? All those in favor say aye. Opposed, say nay. That concludes our meeting, or entertain a motion to adjourn. Motion made, properly second. Any questions? All those in favor say aye.
All right.